Good morning, good afternoon, and good evening to all members of the Pasteur Network community, and welcome to this new edition of the Pasteur Network monthly seminar. Thank you very much for joining us today. It's our last edition of the 2025-2026 monthly seminar, and the monthly seminars will be back in September. As usual, we will begin with our speaker presentation, followed by the Q&A session. Feel free to post your question in the chat or during the Q&A session. To ensure a smooth experience, please keep your microphone and camera off during the talk. The seminar is recorded and will be shared very soon on the Pasteur Network YouTube channel. Today, we're going to Vietnam, in Nha Trang, for a seminar entitled Where Science Met the Tropics, 130 Years of the Pasteur Institute in Nha Trang. And it's our great honor to introduce our speakers, Dr. Nguyen Thanh Dong, Dr. Lu Quoc Phuong, and Dr. Bao Kong Luong Tran. Dr. Nguyen Thanh Dong is Deputy Director of the Pasteur Institute in Nha Trang, in Vietnam. His research focuses on the epidemiology, biology, and control of vector-borne and arboviral diseases, particularly dengue, Zika, and Japanese encephalitis. He has supervised Vietnam's national dengue control program along the south central coast, contributed to Monash University's Eliminate Dengue, and served as a key investigator in clinical trials on dengue and COVID-19 vaccine and antivirals. As field epidemiologist by training, Dr. Dong has investigated and responded to numerous outbreaks in Vietnam, including dengue, Zika, and diphtheria, scrubs, typhus, hand, foot, and mouth disease, influenza, while strengthening sentinel surveillance, cross-border health quarantine, and emergency preparedness across Central Vietnam. He is committed to advance Pasteur Institute in Nha Trang research capabilities and workforce, and to expanding in his international collaboration, so the Institute can serve as the lasting regional hub for evidence-based outbreak response within the Pasteur Network. Lu Quoc Phuong is head of Center for Training, Research, Management, and International Collaboration at the Pasteur Institute in Nha Trang. He has strong expertise in microbiology and applied public health. He has contributed to a range of research projects and clinical trials with a particular focus on microbiology, food safety, and antimicrobial resistance. His research addresses AMR through a One Health approach, providing practical evidence to better understand its burden in the food chain and to strengthen food safety practices. In his current role, he coordinates training, research management, and international collaboration, supporting capacity building for the health workforce in Central Vietnam, and promoting scientific collaboration between the Pasteur Institute in Nha Trang and the national and international partners. Dr. Tran Bao Kong Luong is a researcher, medical doctor, a researcher at the Pasteur Institute in Nha Trang with a strong interest in infectious disease epidemiology, clinical trials, and international scientific collaboration. Her work focuses on generating evidence to better understand the burden, transmission patterns, and molecular characteristics of infectious diseases in community and clinical settings, including clinical trials, disease surveillance, data collection, and coordination with national and international partners. Her current research activity focuses on pediatric respiratory infection, particularly the epidemiology and genotyping of respiratory syncytial virus among children in Can Hoa province in Vietnam. Through this work, Dr. Tran aims to advance understanding of RSV circulation and genetic diversity, supporting future prevention and control strategies for respiratory infections in children. So, before giving the floor to our speakers, I would like to just give a few words on what you're seeing on the screen, which is the PN link. So PN link has been launched almost 9 months ago now. It's the Pasteur Network internal knowledge sharing program, and it's completely for free for all the members of the network. We are now more than 1,300 activated members on PN link, and many people can share opportunities, events, and activities. There are also several groups in specific fields, and we are planning to set up more and more groups to spark collaboration and to increase exchanges between the members. PN link is now more and more one of the central hub for everything related to the Pasteur Network. So if you have any question about the Pasteur Network or the opportunities within the whole network, please just have a look to Pin Link. The opportunities and the events are posted there. And of course, you can share anything you would like to share on your activities and projects as well. Okay, so I think I talked too much. So now I'm giving the floor to Dr. Dong, who will be introducing the Pasteur Institute in Nha Trang. Dr. Dong, the floor is yours. Thank you very much.
Okay, thank you very much. Distinguished colleagues, dear members of the Pasteur Network, good day to all of you. I am Dong, Deputy Director of Pasteur Institute in Nha Trang. It is my great honor on behalf of the Pasteur Institute in Nha Trang to warmly welcome you to this seminar of the Global Pasteur Network. I would like to sincerely thank the Pasteur Network for giving our institute this meaningful opportunity to share our history, to share our scientific journey, and our vision for the future. So as you know, the theme of today's seminar, Where Science Met the Tropics, 130 years of the Pasteur Institute in Nha Trang, that carries a very special meaning for us. It reminds us that science does not grow in isolation. Science grows when it meets real communities, real health challenges, and real needs. Over the past 130 years, our institute has contributed to many important areas of public health. Our work has included research in many subjects, not only in infectious disease, but also in uncommunicable disease and other public health events. My institute has also played an important role in responding to other public health events, including COVID-19, dengue, and hand, foot, and mouth disease, measles, influenza, and food safety as well. And through these efforts, we have always tried to connect science with action and evidence with decision making. In recent years, the Pasteur Institute in Nha Trang has continued to strengthen our research capacity, especially in international cooperation. Over the past decade, we published 140 of genre publications, and we also collaborate with more than 20 international institutes and universities in over the world. Looking ahead, the Pasteur Institute in Nha Trang is committed to transforming its scientific heritage into the future innovation. We aim to further develop digital transformation and data-driven surveillance, and especially a stronger collaboration within the global Pasteur Network. And the theme of the seminar today is not only an opportunity to look back at 130 years of history, and also an opportunity to look forward. And it is a chance to reflect on how our legacy can inspire new science, new policies, and new contribution to public health in Vietnam and in Pasteur Network as well. Once again, I would like to say thank you very much for your attention and for today. I wish all of you good health and open discussion and very successful seminar today. And the next, I would like to invite Ms. Lương Công Bảo Trân. She will have a detailed presentation today. So after that, we will open discussion. Are you okay? So please, Ms. Trân. Mr. Presenter.
Yes,
Thank you so much here.
Yeah. Thank you,
Thank you, Dr. Dong.
So I would like to share my screen. So can you see my screen now?
Yes.
Okay, yes.
Okay, so thank you so much, Dr. Dong, and good morning, afternoon, and evening, all the colleagues here. So I'm Chung from Pasteur Institute in Nha Trang, and today I will represent Pasteur Institute in Nha Trang to give you the introduction about the scientific journey of 130 years of Pasteur Institute in Nha Trang, where science met the tropics. So in the late 19th century, infectious diseases such as plague, cholera, malaria, and typhoid fever raged across many colonial territories, including the Indochina. And in Central Vietnam, where the humid tropical climate fostered the circulation of various pathogens, the epidemiological situation was complex and severely impacting the public health, the economy, and the life of the local population. So faced with this crisis, French authorities and pioneering scientists tried to find long-term solutions for disease prevention and control. So in 1891, Dr. Alexandre Yersin, a brilliant student of the renowned scientist Louis Pasteur, arrived in Vietnam, and driven by a passion for research and a desire to improve public health, he undertook numerous expeditions to study the climate, geography, and disease patterns in the central provinces. And after discovering the like Bacillus Yersinia pestis in Hong Kong in 1894, Yersin returned to Nha Trang and proposed establishing a medical research facility dedicated to disease prevention, which was known as Pasteur Institute in Nha Trang. So Pasteur Institute in Nha Trang, or PINT in short, was established in 1895 by Dr. Alexandre Yersin, and since 1975, PINT has been working directly under the Vietnam Ministry of Health to perform preventive medical function in Central Vietnam. So our Pasteur Institute in Nha Trang is part of the National Preventive Medicine System, and the country is divided into 4 regions, and PINT is responsible for the central region, as you can see here. So this is an overview of our workforce and staffing structure, including 157 staff in total. And for the facility, our main campus located on the Strongfoot Street, which houses the Center for Food Safety, the Medical Service Center, our laboratory building, and the Yersin Museum. And on the second branch, we host the Training Research Management International Corporation, our clinical trial unit, and One Health unit. And on the third branch is the place for the Dr. Yersin Cemetery and our chief stables. So this is the organization of our institute. It consists of our board of directors, scientific committee, and ethics committee, together with 3 research units, 3 centers, and 3 admin departments, which include the Center for Training Research Management International Corporation, Center for Food Safety, Center for Medical Services, Department for Disease Prevention, Department for Environmental and Occupational Health, and Department for Microbiology and Immunology. So in the Department for Disease Prevention, there are teams managing the infectious disease, vector-borne disease, and non-communicable disease separately in the Central Vietnam. So this is the Department for Disease Control. So it's responsible for planning and executing technical guidance, disease monitoring, and emergency responses, covering the infectious and non-communicable disease, vaccination and nutrition programs, as well as consulting and pest control services. The Department for Microbiology and immunologists provide the diagnostics testing across microbiology, immunology, and molecular biology for high-spread disease. It also produces biologists and diagnostic reagents used across the health system. And beyond testing, the department works to strengthen technical capacity at lower level facilities, extending its expertise in this level in these facilities. So the laboratory achieved the biosafety level 2 ISO 15189 with modern and specialized testing equipment such as PCR, real-time PCR, automated ELISA, whole genome sequencing machine like Illumina. And this is the Center for Food Safety in Central Viet Nam. So it covers these core functions as technical control and specialized testing, state inspection of imported food, and issuing conformity certificate for designated products. It also manages and supports the prevention and mitigation of food safety incidents while driving scientific research and international cooperation with other partners. For the Department for Environmental and Occupational Health, this department direct, monitor, and support lower level in protecting the community from environmental and climate change risk, from the safety of drinking and domestic water, also occupational hygiene, sanitation in school and household, and disaster preparedness. They also support for pathogen surveillance, community health management, and also do sampling and analyzing environmental and occupational hazards, running physical, chemical, and microbiological tests, monitoring workplace, and screening for occupational disease. We have the ability to test most virus and bacterial pathogens that cause human disease, such as HPV, HIV, dengue, Zika, and other bacteria, such as Salmonella, Shigella, Campylobacter. Our facilities include the COPAS 8000, Sysmex analyzers, and other advanced instruments for testing and calibrations. So this is the Center for Medical Services, and it is responsible for providing community healthcare and services in screening, early detection, and prophylactic treatment for infectious disease and non-communicable disease. We also deliver primary care, immunization, and surveillance support to lower level healthcare units. And the last one is the Center for Training, Research Management, and International Cooperation. So this unit leads planning, implementation, and reporting in continual education, hands-on training, communication, research, clinical trial, and international cooperation in public health, and it is also the focal point in partnership with domestic and international organizations to deliver scientific and technological services, and also provide the training services. So for the field of researches in the bacteriological pathogens, our group type of research found a 62% positive rate for Orientia susugamushi in Kanhua, by using the quantitative RT-PCR to determine the presence of bacteria and gene sequencing for the genotype determinations. And also our diphtheria work identified 10 toxigenic strains on penicillin susceptible, but 80% resistant to sulfamethoxazole G-mesotrim. In the melioidosis research, we isolated 5 strains from 179 clinical samples by using the control and bacterial identifications and the agar diffusion method for antibiotic susceptibility. So for the field of research in virological pathogens, 23 years of dengue data show temperature as the dominant driver of transmission, challenging the assumption that dengue is purely an urban disease. And we also conducted the phase 0 study to investigate dengue infection among the household contact of dengue in these cases and assess the feasibility of conducting a phase 2 trial for novel antiviral. So this study operated the feasibility of the IC in this case and household contact design for next research in the future. So, and we also conducted the sequences of the Andes Entropy mosquito in Bình Thuận and in Central Viet Nam and reviewed that 10 virus around 5 families. The first documentation of these insect-specific viruses in Vietnam, we also met mosquito-borne virus circulation, finding that the dengue 2 serotype as the dominant one in our region. So we will have a look at our prevalence infectious disease in our Central Vietnam. So as our region lies in a tropical region, so we have the tropical climate and we have a number of infectious disease in our area. So the first one is dengue fever. A major dengue fever epidemic occurs approximately every 9 to 12 years. So the number of reported cases during average years is 3.6 to 4.3 times higher than the average annual number of cases during the preceding non-epidemic period. And specifically, major outbreaks were observed in the 1998 and 2019. However, in 2022, the region experienced another large-scale outbreak with over 83,000 cases, marking the highest number in 33 years and occurring only 3 years after the previous epidemic peak. So all the 4 dengue viral serotype 1, 2, 3, 4 have been circulating in the central region. Over time, they have been shifted in the dominant serotype with the dengue virus serotype 1 and 2 consistently playing the major roles in transmission and outbreak. And between the 2017 and 2025, dengue serotype 3 was not detected. However, in 2022, there was one dengue virus serotype 3 case was identified in Hoa Nam province, indicating a possible re-emergence of this serotype. This is, we will have a look at the measles. So the total number of the reported measles case in the Central Viet Nam during the 2016 to 2025 reached over 10,000 cases. And we have 2 major outbreaks occur during this period. The first one is 2018 to 2019, and the second outbreak is 2024 to 2025, and the 2024 to 2025 outbreak was the largest, with over 7,000 cases and more than twice the number reported during the 2018-2019 outbreak. And this represents the highest number of measles cases recorded in the regions within the last 10 years. So, and in the central region, as well as across Vietnam, measles outbreaks tend to occur every 4 to 5 years, even though the coverage of measles-contained vaccines remains relatively high nationwide. So this is the chart measles by gender, so that the male cases exceeded female cases by approximately 10%. However, this difference was not statistically significant as susceptibility to measles infections is not gender dependent, but rather related to the level of measles antibodies in the individuals. And for the chart immunization status, illustrate that among a total of 7,190 confirmed measles cases, 4,985 individuals, which accounted for 69.3%, had no record of vaccination or had a no vaccination history. The proportion of individuals who had received a complete measles-containing vaccine schedule was notably low, accounting for only 6.6%. And the proportion of children who were below the recommended age for vaccinations and those who had received at least 1 dose of measles vaccine were approximately similar, at 14.7% and 16% respectively. So this finding highlight the need to strengthen both case investigation procedures and the implementation of routine immunization programs at the local level. The next one is if seasonal influenza. So influenza is among the diseases with the highest annual number of reported cases during the 2016 to 2025 period. However, in recent years, the annual incidence has shown a decreasing trend, except for 2021, when there was a marked decline in the case number, and this reduction may be attributed to the competitive interaction mechanism associated with the COVID-19 pandemic during the spread of the influenza as well as other infectious disease significantly decreased. High-foot-mouth disease is also an endemic disease in the region with a relatively high number of reported cases. The disease occurs throughout the year with peak incidence typically observed in between June to October, and approximately every 5 years the number of cases tend to increase markedly, leading to outbreak with incidence rates from 1.5 to 3 times higher than the 5-year average. And most hand-foot-mouth disease cases are mild. However, severe complications and fatalities can occur, particularly in cases infected with the enterovirus 71 strain if not correctly diagnosed and treated in a timely manner. Viral hepatitis is one of the endemic diseases in our region. So the disease occurs sporadically throughout the year and shows a gradual decline over time, similar to other vaccine-preventable infectious disease. So among the provinces, Kanhua recorded the highest true incidence and mortality rate due to viral hepatitis during the 2016 to 2025, and Da Nang reported the lowest true incidence rate. And the last one is rabies. So rabies is the leading cause of death among infectious disease in the central region, with an average of 9.5 deaths per year, ranging from 5 to 19 cases, despite the high effectiveness of the rabies vaccines and post-exposure prophylactic syndrome. So during the 2016 to 2025 period, 8 out of 11 provinces reported rabies deaths, and Ben Thuận has the highest number of deaths, 31 cases, and these 3 provinces and cities, Huế City, Da Nang City, and Khánh Hòa provinces reported no rabies deaths during this period. So the age distribution showed that the 15 to 59 age group accounted for the highest number of deaths, and male accounted for 61.5% and female for 38.5%, and this difference was not statistically significant. And all fatal cases had not received any rabies vaccine or serum following exposure to suspected rabies animal. So about other disease, so as of September 2025, no re-emerging or newly emerging infectious disease such as chikungunya or cholera have been detected in the region. And in non-communicable disease, our study about the prevalence of undiagnosed diabetes and prediabetes and risk factor also found that 8.1% undiagnosed with type 2 diabetes and over 50% prediabetes in the adult whose age is over 45 years old. And another found strongly into age and obesity, with 2/3 of people unaware of diabetes as a condition. Here are some photos of the outbreak response activities of the Pasteur Institute in Nha Trang. So the first one is the investigation of the contact case of diphtheria in Vietnam in 2015. And the second one is the sample collection for suspected diphtheria case in the Vietnam in the last 2 years. And we also conducted some activities regarding the occupational health checkup for the workers in the Central Viet Nam and do the water sample analysis. This is the pictures about the medical testing, the vaccine consultation for the community, which is provided by the Center for Medical Services. And these are the training activities for the lower level units. So we have we conducted the training and issuance of certificates on knowledge, surveillance, and control of inspect and pest animal, and also training on principles and practices in biosafety level 1 and 2 laboratories. And these are also the field activities in the case investigations in the field epidemiology training program sponsored by the US CDC for healthcare workers in Central Viet Nam in disease surveillance and outbreak response. And this is the pictures of our institute having the science ceremony with our international partners, and also that pictures of some of the delegates visiting our institute. So we have been working with more than 20 international partners globally. So, and 11 MOUs were signed with our international partners. So last September, we have signed an MOU with the Pasteur Institute Laos and Cambodia, Pasteur Institute Cambodia. And we also signed MOU with our Russian partners, the Pasteur Institute in St. Petersburg and Moscow Institute of Physics and Technology, MIPT, and our Swiss partner, FIND as well. For our Asian partner, we also signed with the MOU with the Nagasaki University, Osaka Metropolitan University, and National Center for Global Health and Medicine, NCGM in Japan. And for our Korean partners, we signed an MOU with the Yonsei University Graduate School of Public Health and International Vaccine Institute, IVI, and also the Ecotech company. And for the Taiwan partners, we signed the MOU with the National Shenhua University and the National Health Research Institute in Taiwan. So for our collaborative project, so the first one is our entomology project with the Institute Pasteur in Cambodia, Pasteur Institute in Laos, Nha in Vietnam, and the Research Institute of Tropical Medicine in the Philippines. So this project strengthens the health capacity across the Indo-Pacific region, covering the lab capacity, climate and health surveillance and response. So this program will focus on two core priorities: strengthening integrated approaches to human, animal, and environmental health, and also establishing a framework for inter-network cooperation on epidemic preparedness and response. For the with the collaboration with Institute Pasteur in St. Petersburg, we have been working on 3 projects with them in the field of COVID-19, dengue, and AMR. And for the dengue project, in 2023, we have collected adult mosquito in 3 phases from 7 provinces in Central Viet Nam, and over 12,000 mosquitoes were collected, including the Andes mosquito, which over 50%. And among the 908 Andes mosquito pools tested, 92 were positive for dengue RNA. Zika RNA was detected in 1 pool from Vietnam, while chikungunya virus was not detected. So this provides essential data on mosquito species diversity and arboviral circulation in Central Vietnam, and the predominance of Andes aegypti and the detection of multiple dengue serotypes suggest significant ongoing transmission risk. So the findings support the need for the continuous entomological and virological surveillance to better inform better control strategy and prevent future outbreak. So there are some pictures with our partners in our institute. So some photo of the field activities and also the sample analysis conducted in our research institute laboratory. So we also have collaborated with Dr. Su Jin-chang from Pasteur Institute, Korea since 2022. And we have been collecting and sending samples to IB Korea for analysis. And last September, we organized the 4 Rapid Symposium in Nha Trang, Vietnam on the occasion of 130 years anniversary of Pasteur Nha Trang. So the Rapid Symposium welcomed guests from the National Tsinghua University and the also researchers in Kanhua province to join in order to strengthen the international collaboration for public health. So with WHO, we are implementing capacity building activities to strengthen infectious disease surveillance and laboratory and respond to disease outbreak and public health emergencies in the central coastal region of Vietnam in the 12-month period. And for US CDCs, we are now receiving support from them in the project titled Strengthening Essential Public Health Functions in Central Vietnam in 2 periods from 2016 to 2021 and 2021 to 2026 in 5 components: surveillance and response laboratory, field epidemiology training program, influenza, and immunization. So here are some photos of the field epidemiology training program for the central health workers. So at here, they have the chance to have discussions and also to do the investigation and respond to the outbreak in order to enhance this capacity. And we also collaborated with the Oxford University of Clinical Research Unit to implement scientific research on respiratory agents of community-acquired pneumonia in Southeast Asia, and as well as molecular, genetic, and serological surveillance of dengue, Zika, and chikungunya viruses in Central Vietnam. For Nagasaki University, we have collaborate on implementing studies on infectious disease. So these are the COVID-19 cohort studies on the clinical epidemiological characteristic risk factor for severe disease outcome and long-term complications of COVID-19 cases in Da Nang. And also the clinical characteristic microbiological agents, immune status, long-term complication and risk factor related to severe illness of COVID-19 patients in Kanhua province, and the immunological response to the COVID-19 vaccine among medical professions, normal subject, and reverse COVID-19 cases in Vietnam. For the dengue, we also conducted the study about the burden of dengue fever and respiratory infections based on the hospital and community, and another study on the dengue family transmission study in Nha Trang in 2022, and the nasopharyngeal carriage and seroprevalence survey among school children in Nha Trang in 2023. So we also conducted some vaccinology study with Nagasaki University on COVID-19 vaccine immunity response and evaluation on the effectiveness of reduced PCV schedules. And with the result from the PCV studies, we have published several papers on the prestigious journal like Lancet or the New England Journal. So now we are working on the community and hospital-based dengue study in Kanhua province. So the study site are the community subject enrollment in 4 selected health station communes, 2 in rural and 2 in urban in Nha Trang City. And the population here is the healthy subject whose age ranging from 1 to 65 years old living in these 4 selected wards. So here's some photo of the field activities of the research team in the subject recruitment period and also the sample analysis. And for the non-communicable disease, we are rolling out the new NCD management models at the commune health stations with the support from WHO and PATH, and also conducting cardiovascular cohort study with the Japan NCGM and the Japan Institute for Health Security. For our clinical trial, so our institute also established a clinical trial unit whose principal investigator is our director, Dr. Do Tai Hung, and with the main staff of 17 people. And the research coordination team included 29 staff, and they are all trained in the GCP and experienced in implementing research activity in the public health. And we obtained the GCP certificate for clinical registration scope of vaccine for phase 2, 3, and 4 in clinical trial from the Ministry of Health, and we just renewed it in the last year. And our laboratory obtained the ISO 9001, and we also issue the SOP for the clinical trials. So for our clinical trial activities, we have successfully conducted 2 COVID-19 vaccine trials. With the first one is the COVID-19 intranasal spray vaccines with around 4,000 subjects recruited in the 5 study sites in 2 provinces, and the study completion rate was 95%. So here's some photo of the subject recruitment in the Kanhua province. And another COVID-19 vaccine is the COVID-19 intramuscular injection vaccine, and the sponsor is Shionogi from Japan. We successfully recruited 300 subjects in 2 study sites in Thừa Thiên Huế and Quảng Bình, and the study completion rates were 90%. This is the picture of the Dr. Yersin photo exhibition with the topic "Life without traveling is not worth living." So this exhibition showcased photos from the 3 expeditions that Dr. Yersin made from 1892 to 1894, exploring the pristine lands to the west of Nha Trang city. And this is the pictures of the students and the teachers of the Yersin Secondary School in Hanoi visiting the exhibition. And the exhibition at the 160th birthday anniversary of Dr. Alexandre Yersin and the 128th establishment anniversary of Pasteur Institute in Nha Trang, we honorably welcome the participation of several diplomats and representatives of foreign organizations, including the Swiss ambassador to Vietnam, His Excellency Thomas Gus, and also Mr. Gilles Andros, Health and Social Development Attaché of the Embassy of France in Vietnam. So we also participate in some activities in the Pasteur Network. So last year, our institute has assigned 1 researcher to participate in the Pasteur Network convening on wastewater surveillance in France in June last year. And also our delegations also participate in the Pasteur Network annual meeting in Ho Chi Minh City last year. So this is the photos of Dr. Hung, our director in the last year during the last year network annual meeting with our colleges from the Pasteur Network. And last year, our institute also had the honor to that Dr. Thieu, a young researcher in Pasteur Nha Trang, was awarded in one among 40 young researchers who demonstrated excellence in scientific research and public health leadership in the 40 under 40 program of the Pasteur Network. And in the past, the Pasteur Paris also provided tremendous support to us, from helping to build the Yersin Museum and Library to sending your expert Dr. Philippe Bouchis to help establish the Center for Clinical Biological and now renamed as the Medical Service Center and technical training and support for our researchers. And we also honored to have one researchers attend from Pasteur Nha Trang to join the vaccinology course hosted by the Institute Pasteur Paris from the 2024. And each year we have one researcher attending the course, and this is a great opportunity for us to acquire the knowledge of update about the vaccine development against the major infectious disease and future challenges, as well as exchange the mutual interest with other scientists in vaccinology and forming the potential partnership in the future. So over the past decades, our Pasteur Institute in Nha Trang have published more than 50 papers on international journals, around 68 national journals and 65 international ones, of which 10 appear in the high impact and well-recognized journals. So these are our collaboration interests. So we aim to focus on infectious disease, non-communicable disease, AMR, One Health clinical trials, food safety, environmental and occupational health. So as our institute marked 130th anniversary last year, Pasteur Institute in Nha Trang look ahead to transforming the scientific heritage into innovation through digital transformation, data-driven surveillance, molecular epidemiology, One Health approaches, technology transfer, and stronger partnership with the Pasteur Institute with the member across the global Pasteur network. So this is my presentation about the Pasteur Institute in Nha Trang. So thank you for listening.
Thank you so much, Dr. Tron, for this very, very comprehensive presentation of the Pasteur about the Pasteur Institute in Nha Trang. Many things are happening in Nha Trang, and thank you so much for sharing it with us. And you're already having a lot of collaboration with members of the network, so it's really nice. We have already a question in the chat from Yasaman Taslimi from Pasteur Institute in Iran. And she's asking if you have any cutaneous leishmaniasis cases in Vietnam. So cutaneous leishmaniasis. Do you have any cases of cutaneous leishmaniasis in Nha Trang or in Vietnam in general? And are you working on this disease? Not the visceral leishmaniasis, the cutaneous one. No?
Sorry, I'm not clear about your question. Could you repeat, please?
Okay, so it's in the chat, Dr. Don. So it's our colleague from Pasteur Institute in Iran is asking if you have any cutaneous leishmaniasis cases in Vietnam, and are you working on cutaneous leishmaniasis? It's an infectious disease. No.
So sorry, maybe might interruption. So Dr. Pham and Dr. Chen, please can you hear the question or not? Please tell me the question.
Okay, it's in the chat. You can read it by yourself, but I will repeat it. So our colleague from Iran is asking if you have any cutaneous leishmaniasis cases in Vietnam. It's in the chat.
Malaria and pertussis, right?
It's leishmaniasis. It's another disease.
No. Yeah.
Okay.
You're
not working on this on cutaneous leishmaniasis.
Yeah, we did not detect any case in the central region of Vietnam. Yeah.
Okay, in that. Okay, good to know. Thanks. Okay, any other question? I think your presentation was so comprehensive that no one has any question.
So it is my honor to invite all of you to come visit my institute in the next time. Yeah.
So if we don't have questions, I have a question very quickly. A very general question. There is a question from Eric from Hong Kong. So how do you deal with sending samples abroad? Well, it's an important question for all our members. So how do you deal with sending samples abroad? What is the legislation, the Vietnamese legislation? How do you do that?
Okay, for this question, Dr. Pham, please answer, please.
Yeah. So thank you very much for your great questions. Actually, the also difficult questions. In Vietnam, we would handle the sending sample abroad at regulated spot, not just at the shipments. The exact route depend on whether the sample are human infectious specimens, clinical sample, or microbial isolate or culture, or animal or environmental sample. So it depends. For genetic results like DNA or RNA are simple, but like human infectious specimen are very strict for sending abroad. So for human infectious or suspected infectious specimen, the core regulation is the circular number 43. We have to follow the circular number 43. It belongs to Ministry of Health for on management of infectious disease specimens, and we have to get approval from the Ministry of Health before sending the sample outside Vietnam. So that's how we send the sample outside Vietnam.
Okay. Thank you so much, Dr. Pham.
Yeah.
So I want to add more information. In the past decade, we collaborate with Nagasaki University and St. Petersburg and other partners in more than 20 countries in the world. I saw that it is not difficult too much to send a sample to go to abroad, because we are doing following the MOH guidelines, and when MOH approved, we are ready to send the sample to the partners abroad. Yeah, it's not too difficult. Okay.
And of course, we have to classify whether the sample belong to category A or category B of infectious substance. We have to classify, and then also following the international guidelines also.
Okay. Thank you, Eric, for a question. Thank you for your answer, Dr. Dong and Pham. Any other question? Well, I have a quick question, if you don't mind. You in your presentation, you showed that you have so many levels of collaboration, mostly another one, to have a reference for the numbers you shared. What is the population of Central Vietnam? Okay. So we have a question from Macarena Saroca from Institute Pasteur in Montevideo in Uruguay. So the question is, to have a reference for the numbers you shared, what is the population of Central Vietnam in your region?
Thank you very much for the question. And there are more than 12 million population in the Central Vietnam.
Okay. Thank you, Dr. Dong.
Yeah, well, my institute responsible for 11 provinces in Central Vietnam. Yeah. It's about total more than 12 million people population. Yeah.
So I was wondering if you thanks to your expertise and more specifically, you talked about several projects on dengue, and 3 weeks ago, the Pasteur Network launched a kind of communication campaign with many members on dengue, and we discovered, not discovered, but we showed to the world that the Pasteur Network, many of the members of the Pasteur Network are working on dengue in all the continents. So is it something that you would be interested to build collaboration, of course, with your region, but also with other regions from the Pasteur Network, like Africa, Europe, Mediterranean, or Americas, and how can we help you with that?
Okay, thank you very much. For dengue fever, it is a endemic infectious disease in Central region. Every year, we record more than 30,000 to 50,000 dengue cases in our Central region. And actually, now we are implementing with many partners to research on the dengue fever, and also about clinical trial on drugs, preventive drugs for dengue fever, and vaccine as well. Yeah. And talking about dengue, we are available and ready to collaborate with members of Pasteur Network to implement project, dengue project, yeah, in regional and Asia Pacific region.
Good.
Okay.
Thank you. Dr. Dong. Okay. If you don't have any other questions, I think we can conclude the seminar. Thank you very much to everyone here. And that was the last seminar of the season. And we will, meet on September 10 for the next 1 month Pasteur Network seminar. Thank you again, Dr. Tran, Dr. Fong, and Dr. Dong, for your time and for the presentation, the very comprehensive presentation about the Nha Trang Pasteur Institute. Thank you so much, and have a nice day. Nice evening, nice afternoon.